let me introduce myself first, and then I will let Dr. Khan introduce him. My name is Dr. Adnan Ahmed, and I am a psychiatrist, and I am working in UK. I am originally an international medical graduate. I came from Pakistan. I came in 2005, and I started my training in psychiatry around 2007. And I finished my training in 2016. I specializes in old age psychiatry, and I'm based in a place called Wales, which is within UK. And I've been one of my hobbies, you can call it, or thing I like to do is to help international medical graduates understand the different psychiatry pathways, understand what psychiatry is, address some of the myths which are associated with psychiatry. So I have met Dr. Khan. Haven't met him face to face ever, but online. Whenever I see him, I am very impressed with him because he's also doing the similar thing, but from the US point of view. He's helping a lot of international medical graduates from US assembly path, and also understanding how psychiatry is being worked in US. So this session was, I requested Dr. Khan especially, and he was already talking about that we should do something where we can compare and contrast and see how things are working in UK and how things are working in the US. So first of all, thank you very much, Dr. Khan. And if you don't mind, can you introduce yourself as well so the audience would know?
Absolutely, absolutely. Thank you, Dr. Adnan Ahmed. And again, we met each other online, and I remember still that one of the posts of Dr. Ahmed I saw is that he beautifully summarized the differences between PLAB and USMLE. We did that, and then I liked it, and I reached out to him, and uh, from there we started. Just give me 1 second. Just give me 1 second.
Okay. So if there's any particular questions, I mean, the audience which are watching live, if there are any particular questions, please do post in the link box. But what we plan to do is I will let Dr. Khan talk about how psychiatry is practiced in the US. So if you are international medical graduates or a medical student looking to go to the US, what steps you need to take to get the psychiatry residency. Then we will talk about how things are done in UK and what are the different subspecialties of psychiatry in UK, and how can you get into that, and how do you become a psychiatrist working in UK, and how do you become a psychiatrist while working in the US. So if there are any questions, please do comment. This is live on Facebook, so you can certainly comment on the in the comment section, and we will start to address them one by one.
I apologize. I think that's also part of our lives where even on weekend, I have 3 daughters and they're all under 6, and my wife is also a psychiatrist. So I just had to attend them. I apologize for
That's
that.
all right, no problem. You were introducing yourself. I think that was
Yes, so I'm also an international medical graduate from Services Institute of Medical Sciences, Lahore, and I started my training in US in psychiatry in 2017 from University of North Dakota School of Medicine, and in 2021 I finished that, and then since then I have been working as an assistant professor of psychiatry at Virginia Tech Carilion School of Medicine. It's a medical school affiliated hospital in Roanoke and Blacksburg, Virginia, which is southwest part of Virginia. And like Dr. Ahmed, my passion has always been guidance of international medical graduates, how to get into residency in US, not only psychiatry, internal medicine, neurology, and then also mental health awareness. And for that, I have been recently actually got inspiration from Dr. Ahmed and started a YouTube channel, and Alhamdulillah, it's going well. Trying to upload video on common psychiatric illnesses in Urdu, and also trying to upload guidance for international medical graduates. So we have been discussing this, that we should do like a live session in which we should talk about the differences in the psychiatry training in USA and UK paths for international medical graduates, and also a general overview of PLAB versus USMLE. So that's why I know that Dr. Ahmed is also very busy, so I'm grateful that he was able to arrange everything, and here we are.
So Dr. Khan, I will start with some basic questions which we normally get. let me assume that I'm a medical student who is just interested in psychiatry, and I'm going to ask you some basic questions which we normally get from international medical graduate. So, how do you become a psychiatrist in the US? I understand that your medical studies will involve passing US assembly and then going to US for residency. Can you explain it a bit more than what is the stepping stone? The first steps a person has to take.
So, so whether it's psychiatry or any specialty, the path to get into a residency training in US is the same. That's number one. Number two, there is no general practitioner SHO senior registrar job. It's either the training or it's nothing. That's number two. So it involves for international medical graduates, we have to take USMLE Step 1 and USMLE Step 2 CK. USMLE Step 1 used to be a scored exam. Now it's just pass fail. So again, you can take it during your med school if you can. Now people, due to increased awareness, have been doing that. And then CK is the scored exam that people sometimes take during the med school or after house job, during house job. Now, once you do both of it and you take a language test, OET or TOEFL, and then you also, so it used to be a clinical skill exam. Now since COVID, they just stopped doing that. And now USMLE Step 1, CK, OET, and then there are some other minute requirements you do, and then you get what we call ECFMG certified. So ECFMG is the Education Commission for Foreign Medical Graduates in USA. Once you are ECFMG certified, you technically can apply. So in US, in order to get training, you have to apply for what we call match process. So it's a whole process where you write your personal statement, ERA CV, and you have to upload letter of recommendations. Now, for IMGs, again, we try to get letter of recommendations from doing some attachments, what we call in UK, or observerships in USA. So what we do is we try to get in doing psychiatry, whichever field we are applying to. Either it's a hands-on externship, which is rare, or observership, just shadowing. People sometimes do it within the medical school. During the medical school, we called it as an electives. And after the medical school, it would be observership or externship. So we get letters, people who are unable to come to US because it requires visa, they just attach letters from their home country, which is again, they work. Of course, there's a long debate how much, but it does. And then we apply for that. We apply in September, we put our application. Let's say we apply to 100 residency programs. Now, depending upon how your application is, you will get interview calls from them. And let's say by the end of February, you get 7 interview calls, and interviews are all virtual these days. You do that interview, then you make your rank order list for those 7 programs, and those 7 programs would also rank you. So if you have been ranked high enough, then you will match from 1 to 7 wherever you will. Or if they haven't ranked you, even people with 10, 15, even 20 interviews, which is a very high number, in psychiatry, they have stayed unmatched. So then there's nothing you have to do the next year. So that's the one thing about the USMLE pathway is that the exams, USMLE 1, USMLE Step 2 CK, the American medical graduates also take those exams. So it's not like they don't have to take it. They have to take it. Of course, their chances of getting matched because they take it during their med school, of course, they rotate in those hospitals are higher, but still they do compete with IMGs 1-to-1 and they have to take those exams. So it's nothing, there is no extra exam that IMGs are required to take other than OET, which is just like a language exam.
Okay. So once you have secured your residency, what does the residency program look like? Because in UK we have rotations, every 6 months, most of the time, in 6 months, we're rotating between general adult, old age, child psychiatry, rehab psychiatry, LD psychiatry, forensic psychiatry. So what does your program look like? Do you actually work in one hospital, one place, or you have rotations as well?
Yeah, so it depends. So psychiatry residency in US is 4 years.
Yeah.
So during the first year, we have to have 4 months of internal medicine, or what we call general medicine, and 2 months of neurology. Now that internal medicine could be inpatient, working directly with the hospitalist, team rounding, or it could be outpatient. And then neurology again can be inpatient and outpatient. And then in first year, there are 6 months of inpatient psych.
Mm.
Now it depends upon individual residency program. There is no like requirement. Some people like my program right now would have 2, 3 sites, like a Veterans Affairs hospitals, a university affiliated hospital, a private non-for-profit hospital. They would rotate. Usually the structure is such that they would rotate at least 2 to 3 sites within, of course, the same vicinity, or at least within an hour drive. There's also a concept of state hospitals in USA, where the most severe and chronic patients, psychiatric patients, are being treated, standalone psych hospitals. So a lot of residency programs also have their residents rotate there. So that's the first year. And in second year, then we start to have partial hospitalization, addiction medicine. We also usually start to have outpatient clinics in second or third year. And then we have forensic psychiatry rotation, mandatory psychotherapy. Some people would directly do like clinic of psychotherapy with psychologists as the supervisors. And then again, crisis clinic. So there are some co-rotations that ACGME is the organization that oversees everything, mandates residency programs, and then of course there are electives. So in third year, outpatient would be the main focus in many residency program, and in fourth year, main focus would be just on electives. You can do neurobehavior, you can do dementia clinic. Again, geriatric psychiatry is also one of the core rotations. So people do neuromodulation, like I have a passion, I've been doing ECT, TMS, outpatient ketamine, VNS, a lot of things. So those are the 4 years that there are some mandatory rotations, some elective rotations. And after those 4 years, you graduate. Of course, there are certain requirements you have to fulfill in order to go from first to second, second to third, third to fourth year. And after 4 years, you have to take a board exam. Now, important thing is that board exam, A, it's not very difficult. You have to prepare, of course, but even people who do not take it, you don't have to take it right away. There would still be board eligible psychiatrists. Even IMGs, they can still do jobs. Like I was in Pakistan when my board exam was scheduled. Due to some visa issues, I could not take it. I could, when I got back, I could still start my job, and I took it the next year, and I passed. So it's about board eligible psychiatrist and board certified. So the board in USA is called American Board of Psychiatry and Neurology. So the board is same actually for both psychiatry and neurology, but it doesn't mean if you have done residency in psychiatry, you should be practicing neurology or otherwise. But we do have a lot of intermingling of both specialties. So that's how the structure works here.
So one last question. So people will ask, what is the fellowship concept then? If you want to super specialize, if you, after becoming a board certified psychiatrist, you can call yourself psychiatrist. But if you want to further study, what are the options? Do they have options all across the US, and how difficult are they to get into?
Yeah. So in US, the good thing about psychiatry fellowships, that one thing is there are a lot of them. The second thing is it's not competitive to get in, because once you are done with 4 years of training and you take your board, you are a certified adult psychiatrist. In US, the supply and demand of psychiatry is in the favor of psychiatrists right now. Huge demand and limited supply. It's a golden era. So after doing 4 years of training, you are adequately trained to do pretty much everything except for child. Even in smaller towns, people are also doing child. So what people do is, a lot of time people would not go for specialization. Now, the specialization which are present, the most common is child psychiatry. We call it as child and adolescent psychiatry. There are two ways to do it. Some people would directly transfer after doing 3 year of residency and do 2 more years, and they will be then eligible to pass board adult psychiatry board and child adolescent psychiatry. Some people would actually join the 5 year program, which is just fast track to both adult and psych, both adult and child psych. Then we have forensic psychiatry 1 year fellowship, geriatric psychiatry 1 year, consultant liaison, or now we call it psychosomatic medicine 1 year fellowship. We have addiction psychiatry and addiction medicine, both separate 1 years of fellowships. Then we have some of the non-accredited fellowships. One of them is interventional psychiatry, in which you are trained in neuromodulation, ECT, TMS, ketamine. Uh, and then we have behavior neurology or psychiatry dementia fellowship. So there are some non-accredited one, and then there are some. Most of them are accredited. Uh, Psychiatrists also apply to pain medicine fellowship, which is 1 year. And then they can also apply to sleep medicine fellowship, which is 1 year. And a lot of psychiatrists actually do that as well. So these are the common fellowship which people apply. And again, pain and sleep could be a little comparative for psychiatrists. Again, pain a little bit, sleep not so. But all the other specialties in psychiatry, most of the time the spots are left unfilled. And that's why I recently uploaded a video that those spots can be filled by people who have done training in their respective countries, whether it's Pakistan, India, even UK. The only requirement is they have to take the USMLE exams, but they don't have to like ace them, they just pass them. And with the home country residency or foreign country residency, they can actually do those fellowships very easily. And I know a lot of people who have done it.
That's fine. Thank you. Thank you very much. I think that was a great insight. And as you said, psychiatry as golden era, you can call it, that shortage of psychiatrists all across the globe. I think it's just not just US, but all the developing countries, Australia, UK, even in Europe. When you speak to the doctors there, they always talk about shortage of psychiatrists. So mental health awareness is increasing, and that demand for psychiatry has been increasing as well. And they don't have enough people trained. And if you become a trained psychiatrist, then you are sought after all around the world.
Absolutely.
So,
And now I would request you if you could briefly describe, because in UK there a lot of people ask me actually. I think one of the concerns when I was a medical student was that if you go to UK, you do PLAB, you might not get a training position right away. You may have to work like as senior house officers, SHO for a few years. So please, can you please describe a brief process about the PLAB and chances these days, attachments and the process?
So, as you said, to work in UK, you as a doctor, you need GMC registration. So GMC registration, there are different pathways. So PLAB is one of the pathways, and this is a relevant pathway for junior doctors, because PLAB is testing your knowledge right at the level of final year medical student or an intern doctor. It has wide subjects, all of the subjects, which we study in final year medical school. So that is one pathway, but this is not the only pathway. There are some other pathways as well. So if you have passed any Royal College exam, you can get it as well. Then there's an MTI pathway, sponsorship pathway. There's a whole list of other pathways you can get GMC registration. So first thing is to get the GMC registration. So then after that, you have the option of directly applying for training, or you need to start a non-training job. So now people will recommend, including myself, to try and get a non-training post first. So non-training post, as a junior doctor, you're actually working and doing the similar and same things, but you are on a limited contract and you are employed by that particular hospital, not by the deanery. The trainees are employed by the deanery. The advantage of that is that in non-training post, you will have less pressure on yourself because you don't have to prove any competency. You don't have to pass any exams. So if you do it for six months or a year, most IMDs will start like this. Then it will build a confidence that you understand the system now, and then you can apply for training. In terms of applying for training, there are basically one major requirement, which is that you need to prove to them that you are foundation competent. Foundation years, what we call internship, maybe in US, we used to call it house job when I was junior doctor in Pakistan. So the foundation years in UK are 2 years for 24 months. And then when you're applying for training, they want either a certificate from a foundation school here that you have achieved those competencies, or there's a form called CREST form, which is basically a very simple form, tick boxes your senior can do to say that you're competent in doing all these things. That will make you eligible.
One quick question.
Yeah.
So that foundation year, does it need to be, is it like general medicine, or does it need to be like psychiatry if you are trying to get psychiatry training?
So for psychiatry training, psychiatry experience is not required at all. You don't need anything to do with psychiatry. This might be your first job. When I actually started my psychiatry training in UK, that was my first job. I've done foundation year in the past, and that was obs and gynae, orthopedics, and GP. but I didn't have psychiatry experience on my CV at all. So you don't actually need that at all. I was going to come to that. The recruitment for psychiatry, once you have submitted a trust form, and then you have evidence that you have 24 months on your CV, including your internship, and 24 months could be anywhere in the world. All of it doesn't need to be any of that experience need to be in UK. It doesn't need to be in the UK. Once you apply for training, then there's an exam called MSRA, which you have to take, which is a multi-specialty exam, and it sort of kind of ranks you that where are you, and if you based on the score of that exam, you will get then a rank, and then you will compete for the matches. So there is actually no, what I'm trying to say is there is no interview stage like in the US, that you actually have to face a residency interview. We actually don't have interview. We just has an exam which you have to pass to enter the training. And if you are applying for multiple programs, so for example, if you're applying for GP, you're applying for core surgical training in psychiatry, you can do that. That MSR exam is just one exam. You don't have to take it multiple times. You just take it one time.
Okay.
And it will just give you the score.
Okay. So, and right now, the level of competition, let's say that what I understand from you is that you, of course, have to pass PLABs, that's one route, and then you have to do those 2 year of foundation year training. Now, you said that training could be anywhere in the world, or it has to be UK only?
No, it can be anywhere in the world. So for 24 months, this confuses a lot of people because, the way they've written. So 24 months includes your internship. So if you have done internship in your home country, house job, then the 12 months are gone from that. And then you just need extra 12 months. That could be, so if you're working as a medical officer back in Pakistan or India, those will be counted as well. If you started to do a non-training job in UK for 12 months, any specialty, those will be counted as well. What they're trying to do is, the reason they put 24 months is because the local British graduate will do actually 24 months of job, their foundation year, and then they'll apply for training. So if they remove that, then they might feel that people are coming from abroad just doing 1 year of house job, and they don't have.
Very important. This is very important point. Thanks for clarifying. Now, the other question, the local UK graduates, do they have to take PLAB?
No, they don't have to take PLAB. This is a good thing. They just pass their own medical school exams. But now what is happening, there's an exam coming through, which is called UKMLA, which will be in the next few years. It's not yet up and running right now, but that they are trying to copy the US model. Then they are making an exam, which the UK medical graduates will also take, and IMG will also take. It looks, if you look at the information available about that, it looks exactly like PLAB, that you have to do an MCQs exam, and then there's a practical OSCE-like exam, exactly like what PLAB is. But the same exam would be actually done by the UK medical graduates as well. But for now, when we're speaking in 2020, end of 2023, there is no UK graduates are not doing UKMLA or PLAB.
All right. Now, the other question I have now, let's say that I'm a medical student in Pakistan right now, and I'm listening to this interview, and I feel like, okay, I want to get training in UK. What should that person do? Let's say that person wants to do general medicine or psychiatry. These two, let's focus on them. So can that person take PLAB during med school? Because I don't remember, but I think that you have to be a graduate before you can take it.
No, you have to have graduate, and then you take the OET in IELTS first. So after your graduation, you take. What I did was, when I was waiting for my medical school exam result, I started to prep for the IELTS. The OET wasn't then. Once you have the qualification in your hand, then you apply for when you get MBBS in your hand, then you apply for the PLAB 1C. So you cannot do it while you're in your medical school.
So that's a very important difference.
Yeah.
Very important difference, that USMLE you can, but PLAB you cannot. Very important difference for viewers especially. Now, let's say that person do house job in internal medicine as well as psychiatry and pass those 12 months. And then that person, let's say for sake of discussion, that person is doing training in psychiatry in Pakistan. Now, what would be the chances, and then also that person take that MRSA exam? Now, with the reasonable score in that, what would be the chances of such a person who is doing training in Pakistan, taken all exams, passed exam, but no UK experience for now? What would be the average chances of that person getting training in psychiatry or general medicine?
So These are two different specialties. The general medicine has a slightly different pathway to training.
Okay.
Because then they actually have interviews. They will actually look at your
Oh.
portfolio as well. So things like research, if you've done any additional
Mhm.
qualification, audit, if you've done any academic roles, teaching, and
Okay.
all of that, that will all count, because then they have an interview as well. So that's a
Okay.
different path thing.
Okay.
But for psychiatry, you are actually competing, and it's an open competition. You're competing with UK graduates, you're competing with IMGs, you're all taking MSRA exam,
Mhm.
and based on
Mhm.
MSRA, you are getting a score, and based on that score, you're ranking the different jobs, and then
Okay.
you get matched to that. So you asked me about the competition ratio. So for now, if you look at the competition ratio, it's about 1 in 5. So for one job, there are at least 5 applicants. But the funny thing is, because it's difficult to say that, it doesn't mean that all 5 are actually interested in psychiatry. Quite a lot of time, what is happening is that people are applying for multiple specialties, because you can apply for like GP, psychiatry, IMT, sports surgical training,
Okay.
radiology.
Okay.
So they might not be at all interested in psychiatry, but they will appear on the statistics.
I understand what you're saying. So basically, what you are saying is that there's a fair chance. Now, the determining factor, would it be the MRSA score?
Yeah. So the main factor is basically the MSRA score.
MSRA,
That is,
sorry.
yeah, that is a main factor, because that, in the past, when I was training, your portfolio used to count. So you will have to have some psychiatric experience, some research, and all of that. That they have taken it all away. They just said just need to do MSRA exam. But
Okay.
the interesting thing you ask, which is important to note, psychiatry training in UK is actually divided into two different levels. So there is a core
Okay.
training level, which is 3 years, and then there's a higher training level, which is you can call it same as fellowship, that you actually are training in a super specialty. So
Okay.
if you are a trainee in Pakistan, you can actually aim to enter the higher training scope, the path as well. So if what you can do to enter higher training, you have to pass MRC Psych exam. So what
Okay.
happens is, during core training, a core trainee will pass every year. They have to do some competencies and get some reports.
Mhm.
But then they also have to pass MRC Psych exam, which is our Royal College exam. Then they will become eligible to apply for higher training. So if you are working in Pakistan, you can directly aim to pass MRC Psych if you are a psychiatry trainee. Based on that, you can get GMC registration, and based on that, you can actually apply for ST training. There's another form, a core competency equivalence form you can get signed, and then you can directly apply for the higher training. A lot of people have done that.
MSRA exam?
MSR exam, then for higher training is not required. Higher training recruitment is a bit different. So you need, as an essential criteria, you need MRC Psych exam. Either you have done core training, or you need to get that alternative certificate signed, and that will make you eligible. That there's no exam there. You just actually apply, and then they will rank your application. They will ask you to submit your evidence of what have you done so far, including research and all of that.
Okay.
And then
Now,
there's a short interview as well.
it also opens another question. Now, in US, people who directly go into fellowship without doing training like the residency, they may have some difficulties in like practicing in US right after, because they require you to actually have done residency. So what they usually do is they end up applying to residency again, like a backdoor.
Mm.
Now in UK, if someone from Pakistan doing training or finished training and taken MR Psych and got the fellowship training in UK, after finishing that, can they apply for job in UK same as someone who
Yes.
has also done the core training and then progress through?
So you ask a very good question. People ask you, is that a good pathway to directly start ST training? Will I struggle? Because if you've done ST training, you will get the same qualification. You get a CCT, then you can apply for a consultant job in UK. That's not a problem. But the problem is that if you are directly applying to come as a ST training doctor, you are not that familiar with the system. This is where people struggle, especially the Mental Health Act. Because if you've done 3 years of training here, you would know what is Mental Health Act, how to use it. This is, in psychiatry, there's an issue that if you're trying to treat a patient who doesn't have insight, who's been risk to himself or others, how do you actually treat them again? What sort of law is there to actually treat them? Understanding systems, how systems work here, that is an important aspect which you might struggle initially if you start directly in ST training. But people have overcome that. I know many people from India and Pakistan who have passed their MIC Psych while they were in their home country training, and then came to do the ST training for 3 years.
I always feel that IMGs, again, I'm not saying that UK graduates or American graduates are not smart, but I always feel that especially IMGs from Pakistan and India, they are very adaptable, very hardworking, and they are very smart. They like adapt like this, despite of having, of course, English not as our first language and not being accustomed to the cultures, norms, but they adopt very quickly. So that's good. So now the second question which I had and on that topic. So you said the core training and then the specialization. So what kind of specialization training are available in UK?
So there are 6 different type of ST training. So there is general adult, then we have old age psychiatry, then we have child psychiatry, then we have intellectual LD psychiatry, the people who have lower IQ. Then we have forensic psychiatry, and then we have medical psychotherapy. So these are the 6 different ST trainings you can do. But then within those, there are some subspecialties as well. Like, for example, if you're working in the general adult psychiatry, you can do addictions as well as part of that. There are some mixes and matches as well. You can do forensic mixed with CAMS, child psychiatry. You can do medical psychotherapy mixed with adult psychiatry. So at that level, you have a bit more freedom. Liaison psychiatry is another thing then you can do as a general adult or old age psychiatrist. Rehab psychiatry is part of adult psychiatry as well. So you can do a year in that, and then you get endorsement for that. So those things, you can actually get through while you are in your ST training.
Then I think let's discuss, because a lot of people have asked me over the years, and I'm sure they also ask you, the compensation or the salary, during the core training and fellowship training, and then after, once you graduate and you become like an attending or consultant psychiatrist. And I can start with US. So in USA, the salary or compensation during the training, 4-year training, it's almost similar for all specialties, whether you are a plastic surgeon, dermatology, or psychiatry, internal medicine. Now, usually it ranges, but it usually ranges from anywhere from $50,000 to $55,000 to $70,000 a year. And again, after tax deduction, I'll give you a ballpark that you get around $3,200 to $4,000 per month. Usually it's a bi-weekly thing in US. So yeah, almost approximately $3,200 to $4,000 per month, which in US, depending upon if you're alone, family, where you are living, it's a reasonable amount. Then if you go to fellowship, it increases a little bit, not a lot, like from, let's say, 60 to 70,000, you go to 80,000. And then once you become an attending or a consultant, there's a huge boost right now in psychiatry. You're looking anywhere around $250,000 to $400,000 per year, which almost comes out, depending upon where you're living after tax deduction, almost 13 to 16, even $20,000 per month after tax deduction. So this is what we are doing in US now. And in addition to that, so that's, you are doing one job. People also do like locums during their main job, moonlighting, we call it here. They're also doing tele. So I would not be surprised if a psychiatrist in US tells me that they are making $500,000 per year. So that's what the situation is in US. And the last point, that they can do so without actually being very, very stressed out with the work. So in US, a gastroenterologist, cardiologist, they're making more money than psychiatrists, surgeons. But their lifestyle, they are on call most of the time. You get a call, you go do a colonoscopy. You get a call, you do a cath. You have to do surgery. So that is one of the biggest difference. And that's why over the years, more and more American graduates are going to psychiatry, because A, the demand, increased mental health awareness, and the lifestyle and compensation.
So in the UK, as you said, we have same system here. There's as a trainee level, you are paid similar. All the trainees, even if they're working in medicine or surgery or psychiatry, the scales are the same. So they are getting around £3,000 per month after tax and everything. Sometimes it's a bit more, depending on how many on-calls are you doing. It depends on how many out of hours you do.
Okay.
Nights, if your number of nights and number of on-calls are higher, then you get higher salary. We call it enhancement, when you get doing the out of hours work.
Okay.
And then they sort of slowly and gradually, every year you get an increment. So every year of training, you get an increment. They keep increasing. When you are in high training, say by its time you are ST 4, 5, 6, ST 6 is the last year normally, but sometimes people can do ST 7, ST 8 as well. Around that time, your salary is above £4,000. So you're earning around it's more than 4,000, so 4,200, for sometimes £4,500. But there are additional options available if you want to earn more. Like people do locums, which is that if a hospital is short of doctors, they're asking for doctors to do on calls, then you can do that. If what we call, sometimes we call Section 12 work, which is mental health act assessment. If you're doing out of hours, you can get extra money paid for that as well. Something called DOL assessment, which is another part of assessment which our higher trainees do to get some extra money. So once you qualify as a psychiatrist, is unfortunately not as good as was you told us. In the US, that's the problem, and you can see in the UK we are fighting for demand of higher salaries. That is one of the other reasons a lot of people who are trained in UK end up moving to Middle East, end up moving to Canada, end up moving to Australia, because these qualifications where you do it from UK are recognized in these countries. So we start from around 90,000 to 100,000 pounds per month, which will translate into around 5,000, 5,500, which is, to be honest with you, is not enough. But as a consultant, once you have a consultant, and also once you have ILR or British passport, that you don't have immigration restrictions on you. So this is one of the other things I was going to mention, was that in 5 years time you get ILR, which is a permanent residency, like a green card. Then after 1 year you get British passport. In 6 year time, by the time your training is finished, most of the people already have their British passports or ILR. So then they don't have immigration restrictions. So once you don't have that, then you can do a lot of other work, like you mentioned, doing some private work, doing some locums. Some people end up doing full-time locum as well. So there's a lot of scope of adding on salary. So unfortunately, to give very, very blunt answer, unfortunately, the substantive job in NHS as a consultant doesn't pay that much, that you have to look for other avenues, private work and all that, to actually supplement your income.
And very, very comprehensive. Thank you, Dr. Ahmed, answer. And again, a few things while you were mentioning those. So yeah, in even US, when you get promotion from first year residency to second, so again, there's a very couple of $1,000 increase. So that's also there. Now, during the residency, for the first usually 2 years, you cannot moonlight. Usually they don't allow. And for international medical graduates who are working on a visa, they usually, a lot of time, they don't allow during the 4 years of training, but some programs would allow you. If you are US citizen and American grads, they can do what they call moonlighting starting from third and fourth year of their training, and they can earn a lot from even then. And yes, even in USA, so there are two kind of basically hospitals we consider. One is the teaching, where you are affiliated with a university, medical school, medical college, or sometimes non-for-profit hospitals, for-profit hospitals. So in US, the big centers like Harvard, Yale, John Hopkins, they might not give you that kind of money. They don't, because they are big hospitals, people want to be there. But again, if you go, even in bigger cities, go to private hospitals, you get more money. And even if you move from the bigger cities, New York City, Chicago, LA, you get a lot of money. The good thing about psychiatry, which has significantly changed over the past few years in US, is once upon a time, let's say that a lot of people want to go to New York City. The compensation was 160, 180, maximum $200,000 per year, which is again good. But nowadays, even those cities, US and NYC, Chicago, they're offering around $300,000, because again, the demand is so high that they need more and more people. And the other thing I want to mention is in USA, The way the immigration process works is that if you start working on H-1B visa, then after doing your training, 3, 4 years of training, your employer, the next employer where you start working as consultant, they can actually file for your green card right away. And it may take like a year or a year and you can get a green card. But once you get a green card, you basically are US citizen, except that you don't have passport.
Yeah.
So you have almost all the rights and you don't have to travel to get your visa renewed and anything. After that, once you get a green card, it take around 4.5 to 5 years to get US passport. So that is something that is a little bit different. The second is if you are doing your training on J1 visa, then technically you have to, after finishing your training, either you go back to your home country for 2 years and come back, or what we called a waiver, we do waiver here. Supposedly to a like a lesser famous town, smaller town, but again with psychiatry you are getting waiver everywhere, in even in New York City. So you do that waiver for 3 years
Mm.
and then they file for your green card. Uh, but the main issue for US is there has been, and there's also one of the other things I do advocacy is for the visa issues. I myself have suffered from that because they give you, let's say, J1 and H1 visa, irrespective of the fact how long your training is, they stamp it for 1 year. Now, if you are in USA, you don't have to get it renewed, especially the J1. But after 1 year, if you step outside US, let's say you want to go back to Pakistan, meet your family, then you have to get it renewed. You have to appear in a US embassy, whether you do it in Pakistan or anywhere else in the world. The problem is a lot of time, even for someone like me. So in third year, when I went to Pakistan during my third year of training, they just put my passport in administrative processing, which is like an enhanced security clearance, and they took 3 months to clear that.
Mm.
So during those 3 months, my training got delayed. I had to work extra 3 months after the finishing my training. My wife and my daughter they were here because my wife was also doing training. My patients were suffering there because the wait list for psychiatrist trainings in US is huge. But I had to suffer that. And then once I finished my training, in order to convert my visa from J1 to H1, I came back and they had already done the processing one time, but they again put my passport back and it took 4 months. So I think that is one of the biggest issues, the biggest speed bump, the biggest hurdle
Yeah.
uh, for IMGs to get in USA training and even after training is the visa issues. So that is, I want to ask, what about UK? Are the visa issues same?
I think visa were easier in UK, to be honest with you, in comparison. There has always been, and that was one of the reasons, I when I was looking into different pathways, and I thought UK was a little bit easier. So once you get, as I said, there is once you get the healthcare visa here, which is a special visa for healthcare workers, you spend like 5 years on that, and that could be different jobs. It could be training job and non-training job. You not only that if a hospital is sponsoring your visa, you can work it for that hospital, but your spouse will also get the dependent visa, which means that they can also work. Their spouse doesn't need to be a doctor; they can do any job, outside. If they're engineer or whatever, they want to do something else, they can do that as well. Then after 5 years, when you get ILR, which is same as green card, you have all the rights. You can come and go anytime from UK, but you just don't have the passport. You still hold your own passport. After 1 year of ILR, you get automatically the British nationality. You will be eligible to apply for British nationality, and then you get the British passport. Children who are born here will not again automatically does not. This is another thing. I think in children born in US automatically get US citizenship, and the ones who are born in UK
Yes.
doesn't automatically get UK citizenship.
Okay.
One parent, if the one parent is a national and living here, that's a different story. But when you both partners are on visa, then the children will not get nationality. But once the parents will get nationality, then the children will automatically get nationality.
So
So
my
there's a bit.
question is that so once you get that healthcare visa,
Yeah.
let's say your training is for 6 years. During that time, if you leave the UK border, and in order to come back, do you have to get your visa renewed or you can just come back?
No, if you visiting is not a problem at all. You can go to your home country and spend some time there and come back. that's not a problem at all. But if you spend, there's a time limit on that visa, that if you spend like 3 months, I think it's 90 days, something like that, outside of UK, then if you coming back, if you left the job and then came back, then you have to apply for new visa, which you'll get the visa easily. That's no problem. But it will reset the clock. That 5-year clock will ILR clock will reset. Then you have to again that your 5-year will actually
Okay.
start from there. That point.
Okay. That is very important that once you get that visa, you don't have to actually be scared that I cannot go and meet my
Yeah.
family. Because usually, even during the training, 3-4 weeks is the maximum you get off and you go and meet training.
Mm.
The second question I have in the immigration point of view, is there something like extra security clearance or administrative processing for UK? Because my understanding is you don't even have to appear in the interview, you send your documents and they if they approve they will stamp it and send it back. If they
Yeah.
refuse they will tell you.
Yeah, so for doctors, fortunately, they are lenient. So you actually don't attend the interviews. I don't know anybody who's attended interview. You just send your documents. If they have any objection, they can put objections on, and send it back to you. Sometimes it get refused because you haven't applied properly and haven't sent them the correct documents. But if you really have secured a job in UK, it is your trust, your hospital is actually, or if you apply for training, then your degree is applying for visa on your behalf. So they are giving you the certificate of sponsorship saying that we like to sponsor this doctor. So that is normally they are lenient on that. So they won't make too much fuss on that.
That is huge. I mean, I recently, and it has been going for years, people even who after putting a lot of hard work, everything, get training here. Some unfortunate people, IMG, especially from Pakistan, they deny them visa. They put them under processing for months and months and they lose their residency spot. I think that is one of the biggest differences. I think
Biggest
the visa
advantage, yeah.
issues and compensation we talk about are it's one of the biggest. And what we were saying is, so yes, even in US, when you get the visa, let's say you get J1 visa, H1 visa, your dependent would get J2 and H4. But the difference is that the dependent, they cannot automatically start working on those visas. If they want to work, they can only work on J2 for Pakistanis, and then they have to apply what they call Employment Authorization Documents, EAD, and then they can work
Hmm.
anywhere. But yeah, it's again another hurdle and a process that they have to go through.
Hmm. Should we go to the questions if you?
Yes,
I think
yes, I
most
think
of
yes.
most of them are actually coming for you. I'm just reading through them. The first question is, if you have failed any steps during your USMLE, does it affect getting psychiatry match in states?
Absolutely. I mean, because it has become so competitive, if you have failed, I'm not saying that you cannot get it. You can always get anything if you put hard work, dedication, and most importantly, perseverance and persistence. But nowadays, if you require visa, you are not US citizen, a failure means that you would have to work a lot, maybe do some research, strong research in US, like a postdoc fellowship, or you would need to have very strong connections. Otherwise, it would be very difficult, but it's not impossible.
Okay. I just like to say to audience, if you want to ask any questions, this is the time you can put in the comment section. They will come to me. The second one is, I think I'll ask you, the second one you've already answered about the salary package of a consultant psychiatrist in US. And you said that was, you can start from 250,000 to 400,000.
Yeah.
And then depending on, and then you can do private work as well.
Mhm.
Uh, the other one, I think this is another one. I was going to ask you this anyway myself, but this is all about, can a foreign psychiatrist go and do fellowship in the US? And you said people who have done training in UK, CCT, and have become a psychiatrist in UK, they pass USMLE and then they can get fellowship in the US. But what about if somebody is from India or Pakistan, they've done training there? Would they still be eligible for that path?
Yes. And again, I would also request you to go to my YouTube channel and see the video. I uploaded the video. So yes, it does not need to be UK. Basically, anywhere in the world where you have done your psych training, whether in Pakistan it's 2 years of MCPS, MDMS, FCPS, you don't even have to pass that exam. you have done it, and you have to be US ECFMG certified. So you have to take USMLE Step 1, CK, and OET, and have to be ECFMG certified. Then you are eligible to apply for what they call postdoc fellowship.
Mm.
You apply, and a lot of time you will get it if you apply smartly, you have some connections, and they will sponsor you visa. You will go there, 1 year, 2 year of fellowship you will do. Some people would return back to Pakistan and their respective countries and keep practicing there. If you want to practice in US, then you can still do it. They may pay you a little bit less because you haven't done the core training there. But most of the time, what people do is they will apply for residency. And once you have done fellowship in a US system, it becomes relatively easier for you to get into the residency. They will finish their 2, 3, 4 years of residency, and then they will just work in US like anyone else.
So they, after finishing that fellowship, just to be clear, so if I, for example, come to US after passing USMLE, first thing you were saying that there's no way to actually bypass USMLE. So I cannot just have a qualification from UK and then say,
Yeah, no, unfortunately, no.
yeah.
They have, because as I mentioned that even their graduates take it.
Mm.
So yeah, they have almost made it like
Okay.
impossible to bypass that. But the difference is that you don't have to like ace them or nail them, like score really high. You just have to pass them. So that's what I was saying. ECFMP certification is required kind of. So if you have that and
Mm.
you have done training anywhere in the world, you have to show them proof you're golden.
And what is the future of that particular doctor? So after they've finished their fellowship 1 or 2 years, can they then work as a psychiatrist in UK or no, no, sorry, US, or do they have to actually do the residency again and then become a ECH, the board certified?
Yep, yep. So it is difficult. I mean, I'm not saying you cannot. You can. They may let in a certain hospital, they will allow you, they may pay you less. But generalized answer would be that you need to do residency.
Okay.
It helps though, that fellowship helps you to get residency, which is a very competitive process right now. So yeah, you usually would have to do the residency. And I would also tell a lot of for all the viewers who are not only interested in psych but other specialties, that the same pathway apply to other, like many people I know got internal medicine, general medicine training from Pakistan, other countries, and they get fellowship spots in US like nephrology, endocrinology, some other geriatric medicine. The fellowships that are not very competitive, you will not get cardiology, GI, pulmonology, but you can get those spots, and the same principle apply to them.
So next question is about the fellowship again. Yeah, this is about what are the opportunities in the US after completing CT3 training in UK? So you haven't completed the full training, the core training part. Um, can you actually do fellowship based on that? Or and then the same thing they ask again, after fellowship, do you have to then repeat the residency program? So this fellowship, do you need to have completed your training in your home country, or is this number of years you required to actually apply for that fellowship?
Yeah, so they are somewhat lenient. So I think I cannot say for sure, but I think for CT3, the core training, if you have done it, I think they would accept that, and you should be able to apply for fellowship, and you should be able to get it. But again, the principle would apply the same. You have to take USMLE, and after that, it's the same process. So doing CT3 in UK would not exempt you from the requirement to take USMLE or doing residency in order to practice.
Another question that is for you. I think most questions for you. Assalamu alaikum, sir. Does FCPS training in Pakistan help you get a match in psychiatry residency in the US, or it will just be like sort of waste of time? I think they're trying to say.
No, absolutely. That's what I'm saying. That since actually they have finished the clinical skill exams, since they have finished the clinical skill exams, the training, the local experience, home country experience has become very important. And I would even recommend, so even if you are not, let's say, doing FCP, so FCPS training really helps. They like it that you have done a lot of structured training in your home country. Even if you are not doing it, there are many UK trained and US trained psychiatrists in Pakistan. Go rotate with them, just like do an observership hands-on rotation. They would in Pakistan, people are really helpful most of the time, they would allow you. So do that. That also helps. They can write you letter of recommendation,
Mm.
and someone who is trained in US and UK, it would matter. So yes, absolutely it helps.
And the other question is for you as well. Is there any reciprocal arrangement between states and the UK to accept specialist qualifications? I think you were answering that already. Yes.
Yeah, I don't think there's any reciprocal arrangement. I don't think, but as Ahmed was mentioning, if you are US qualified, you should be able to work anywhere from Pakistan, India, Middle East, uh, Canada, New Zealand, Australia. So FR Psych, MR Psych in U from UK, and American Board of Neurology and Psychiatry certification in US, it carries significant weightage and importance all over the
Mhm.
world.
The next question I think is for you as well, but thank you both of you for the session. My question is for Dr. Khan. How can all graduates increase their chances of getting the match in the US program if they have not done in the home country residency? And how important is the UK experience for somebody who wants to apply for US match? All steps, including step three, done. I think they are talking about themselves.
So if you haven't done step three, that would be the first step that can add. And I think UK experience would definitely be, if you have done any UK experience, that they would definitely count it more than Pakistan, because again, UK has a very good healthcare system. And then again, you need to do some rotations in US, get US letter of recommendations, maybe a research position. Sometime even they would pay you. It's a whole new topic how we can get that. Yeah, so basically you need to add value to your CV in order to make yourself attractive. One thing I would tell people is that for psychiatry per se, if you are older graduate but you have taken really good scores in USMLE exam, it they don't mind that much. They do mind that you are 10 years out of your medical college, but still you can get in. So try to take good scores and try to make your CV tailored towards psychiatry, whether it's research or clinical experience.
The next one is for you as well. I have seen US Citizenship Service websites saying that they are willing to sponsor green card directly to psychiatrists if they have work shortage area in the US. Does this include trained psychiatrists from outside, or this is for people who are trained in the US?
Yeah, I'm not an immigration expert, but I haven't heard anyone getting this. It's mainly for the waiver which I was talking
Okay.
about. So usually it doesn't work for people who haven't trained here.
The next one is, I think for me, is in UK, how can I get RC Psych? Which pathway to become a psychiatrist in UK? There is on my YouTube channel, I've done a whole video of how to become a psychiatrist in UK, which include entering from PLAB route, then entering to UK training system via MRC Psych and bypassing PLAB. Then there's MTI route as well. Then there is sometime we have sponsorship posts, which actually if you secure one of those, then you can get GMC registration through that post, and then you can come through that as well. So there's a whole, this is a very the scope of this question is quite large, but I have done a whole video on international psychiatrists, how can they come and work in UK. I have a question for both of you. Are you happy? Oh, how happy are you both with the path you have chosen? I know it's very relative to individual. How satisfied are you from path you have chosen? Do you still feel like going back to your home country? So do you want to answer this first? I should answer this.
Yeah, no, definitely. So from a scale of 1 to 10, I would say that I'm almost a 9 out of 10. I'm happy. I think that the training, and again, I'm not downplaying that there is no good training in Pakistan. There is very good training, very good exposure. But I think just the level of autonomy, not being scared of, like, let's say, being hit by patients' relatives, a lot of stigma. There is stigma in US and UK as well in psychiatry, but a lot less. And of course, the compensation part, Alhamdulillah, I feel very happy. I do not have any immediate plan to return to Pakistan, but what I'm doing, trying to pay back, is all those health awareness work. We, as part of Papana, we have an organization where we do online courses in collaboration with Pakistan Psych Society. Whenever I go there, I always take lectures in medical colleges, in with student organization. Uh, to trying to help. And again, I would also like, with the help of this video, that Dr. Adnan's YouTube channel, very good for students, for people who want to learn more about psychiatry. And again, I request to also try to join my channel because it would ease out easy, understandable videos in Urdu to understand mental health awareness. And for people who want to applying for USMLE, there would be videos for that. And Dr. Nan, I would recommend that let's take this question, just maybe conclude, and then we can answer the rest of, I think, questions by the comments.
By the comments, I think, yeah, I was just going to say, I'm pretty satisfied with my choice of psychiatry, because when I was choosing psychiatry, there was a lot of stigma. And when you're choosing psychiatry, stigma not only come from outside, but from within yourself as well, because you heard stories and your own family, sometimes your own friends say that, what are you doing? I've got a lot of comments from my family that, or my friends, that you were a very good medical student. Why psychiatry? Why can't you become surgeon and all of that? But this was my passion. This is something I really liked. I really was enjoying. So about going back to the home country, a lot of people do that. There's no harm in that. There's no harm in training in UK or US and then so thinking that going back. Main problem which happens with every immigrant is that when we are moving out, we're leaving our parents behind, and watching your parents getting older, frail, getting medical problems and not being able to help them. That is quite that could be quite frustrating for you, and that for that reason, I know a lot of people have to move back or move to different countries nearer their parents. A lot of people who are moving to Middle East from UK, you ask them, why are you going to Middle East? Other than money and all of that, they will also say that I'll be near to Pakistan, then I can go back to my parents relatively quickly.
Absolutely.
So I think there, as you said, there are some other questions as well, but we'll try and answer that in the comment section. I'll go and if you keep commenting, we will answer them. And I will also put Dr. Khan's YouTube channel there. But I'd just like to appreciate him, because I know there are a lot of Pakistani doctors and international medical graduates who have done really well in the US, but not everybody gives their time and effort and do things what he's doing, that actually share their knowledge, authentic knowledge coming from somebody who's actually done it and who is actually sharing their knowledge for free and sharing it widely. Because there are a lot of people who start to charge and start.
Yes, oh, a lot of services. And the same thing I would like to mention for Dr. Raja Adnan Ahmed, that what he has been doing. Actually, the reason I started my YouTube channel, one of the reasons was him, and I got inspiration. What he has been doing, not a lot of people do, and especially for psychiatry. I think for psychiatry, he's the only one. Maybe there's Dr. Latif, what I have seen, that he's also very involved. Other than these two people, I don't see a lot of UK psychiatrists advocating for these kind of things. So one last thing I would like to mention, and I have a very close friend who is a pulmonologist. He's finishing pulmonology training in UK actually. We were talking about stigma, and I have a message for him and other non-psychiatric specialists in UK, USA, and Pakistan, that psychiatry is just like any other medical specialty, like cardiology, GI. You cannot just feel that you can treat psychiatric illnesses because you are a medical, you have done general medicine and your specialty is higher and more important than psychiatry. I think that psychiatry holds a significant importance. Whole world is realizing it. So the message would be that don't try to downplay psychiatric illnesses even within your community, within the doctor community, and don't try to make people feel that psychiatrists or they are shrinks, they are not real doctors, because it not only hurts, it what it end up doing is it would end up hurting your patients. So that would be my message.
Okay, thank you very much. I'll stop the live feed from the
Thank you.
Facebook.